Buddy Blue, and this is Tucker. Tucker is co-hosting from heaven. So, all right. So, how are you guys today? I'm doing great. The sun is shining. There's not a cloud in the sky. I had a great workout this morning. And today we are going to talk a little bit about essential fatty acids, omega-3s and omega-6s. So, we'll wait for people to kind of join in. Looks like Buddy Blue is doing his thing and he may or may not be back. So we're going to start out today's live stream by talking a little bit about how to check for omega-3s and omega-6s, what they actually mean. I think we need to get a basic understanding of what's going on. Okay. So we are waiting for Lucy, my moderator, to come on with YouTube as well as the listeners. It seems like it's lagging a little bit, but you guys over on Instagram, you are doing well. It looks like you're all waving to me, so I appreciate that. When we talk about omega-3s and omega-6s, a lot of you have heard that omega-3 calm inflammation and omega-6 drive inflammation. Now, to some extent, that is true. But know this, we need omega-3 and we need omega-6. They are essential fatty acids that we need in our diet. We cannot make them. Now, when we talk about, good morning, Lucy, we were just talking about you. I'm glad you're here. When we talk about PUFAs, polyunsaturated fatty acids, poly means many. Unsaturated means the chains have double bonds. Wherever there's a double bond, it's a kink. So a saturated fat is saturated with hydrogens on every side of a carbon. So you'll have chains of carbons, and then you'll be saturated with hydrogens. But a polyunsaturated or a monounsaturated will have one or many double bonds or kinks. Now, a poly, many, unsaturated, many double bonds, is a very flexible chain. He can kink himself. He can stay liquid at room temperature. So that you know that this is not butter for the most part. It's a liquid, like some sort of oil, whatever oil you want to talk about. Now, when you decide whether a chain is an omega-3 or an omega-6, go lay down. You actually go to the tail end of the chain and start counting. It's called the omega carbon. An omega-3 will have a double bond at the third carbon link. An omega-6 will have their first double bond at the sixth carbon link. Once the first bond, whether it's a 3 or a 6, is placed, it just keeps repeating itself on down the chain. An omega-3, an omega-6, thank you, whoever sent that. I appreciate that on YouTube. Sabrina, is it? Let me see. Yes, thank you, Sabrina. I appreciate that. Super sticker. Those are nice. So if you guys, I appreciate you guys, the super stickers, the super chats. I just appreciate you being thankful that what I do every weekend. And so thank you. And for those of you who are on Instagram, you will see a live fundraiser for Rescue Rehab and Rehome this weekend. Actually, tomorrow is Tootsie's birthday. And Tootsie is trying to raise money for Rescue Rehab and Rehome. It's where her two brothers came from, Tallow and Buddy Blue. So please, if you can, only if you can, support that rescue for her birthday tomorrow. We'll do that today and tomorrow. Good morning, Lion. We'll do that fundraiser for Tootsie and Rescue Rehab and Rehome in her honor. All right, so back to the omega-3s and 6s. They are considered long chain fatty acids or very long chain fatty acids. They are not medium chains and they are not short chains. For instance, an omega-3 is C18, C20, C22. Those are omega-3s. C18 would be alpha linoleic acid. This is very common in people who eat plants like flax and chia. They will get C18. And they are not DHA or EPA because EPA is C20 and DHA is C22. You can't, well, for the most part, it is very difficult for our body to take in ALA C18, which is an omega-3 in plants, and make DHA or EPA. In other words, many of you think that you're getting omega-3s by taking flax oil or flaxseed and ground chia, and you think you're getting omega-3s. You are getting a plant version, which is ALA, and then you are asking your body to convert ALA into DHA and EPA. You must elongate it, in other words. You must take a C18, alpha linoleic acid, and make a C20 or a C22, which is your EPA and DHA. I would not rely on plant C18 alpha linoleic acid, ALA, to make my DHA and EPA. I just wouldn't rely on it. Our body is very inefficient in converting ALA to DHA and EPA. Now, EPA, C20, is fish oil. It is supposedly heart healthy, heart protective. The DHA, which is C22, is good for our brain and eyes. If we switch gears and talk about omega-6s, the two most common omega-6s is linoleic acid, another C18, and arachidonic acid, which is another C20. Now, as a review, we need omega-3 and omega-6. Unfortunately, we are getting a lot of omega-6s and maybe not enough omega-3s. It is possible that we are taking in way too much processed foods with way too much industrial seed oils. The big eight are the three C's: canola, corn, and cottonseed. And then the three S's, which is soy, safflower, and soy, sunflower, safflower. And then there's rice bran and grapeseed. Those are the big eight industrial seed oils. Personally, I think they are very unhealthy, but you will find people online, gurus, even cardiologists that promote industrialized seed oils. I can't get on board with that for many reasons. Now, let's say you are wanting to know what your omega-3 and omega-6 levels are, and you go to your doctor, and it's difficult for you to explain, but you just know you want to see what are your omega-3s and what are your omega-6s. Well, your doctor might not be as educated as you. And so when we order lab tests in the system, our EMR, electronic medical records, we will search essential fatty acids. And then whatever pops up first will likely be what we check. When a lab checks essential fatty acid profile, it's really checking C12 to C22. It counts chain links in our body, and it may not be as accurate. For instance, a C12, basically that is MCT oil. C12 is lauric acid, coconut oil. It's a medium chain fatty acid, and it's great for energy. We don't really take it back to the liver and process it. Short chains and medium chains are purely used for energy, quick. The long chains, C14 through C18, are standard saturated or monounsaturated fats. And then your very long chains would be C20 to C22. When you test a simple essential fatty acid profile, you are, you jump up here. You can usually do that. Come on, bud. You are checking for, there we, come on, you can do it. Come. Okay. Now let's sit quietly, okay? This is Buddy Blue. An essential fatty acid profile will test and be not as accurate because it's testing about the last 24 or 48 hours of your blood. It's a serum or plasma level. It is not a red blood cell level. Hopefully that makes sense. When you check an essential fatty acid profile, it is measuring what is actually floating around in your blood right now at the moment. And it can be affected by what you ate the night before. What if you had some salmon for supper? What if you took your fish oil capsule, you know, a day before or even the morning of, because that's what you do? It is not going to be very accurate. It actually could give you a skewed result, indicating that you're fine, but you're not fine. So that's why checking an essential fatty acid profile is not really good for what information you need. Oh, geez. Now we got them playing. It's okay. We're okay. As long as you guys can focus, I can too. What we really want to get is something called an omega-3 index, omega-3 index. It's likely the single most accurate marker for tracking inflammation and cardiovascular risk. That is why you want to know your omega-3s and omega-6s. It will prove if your body is actually, or the food you're consuming or the supplement you're consuming, you're actually absorbing it. Okay. If it's inside the red blood cell membrane, you are checking over a 3-month time period. You're getting an RBC omega-3 index, meaning you are measuring your omega-3s inside the red blood cell membrane. It's more accurate. It also will give me an idea what you've been consuming over the past 3 months, because the lifespan of a red blood cell is 120 days, about 3 to 4 months. All right. So that is more accurate, and it will prove whether or not your food that you're eating, the salmon or the omega-3s you eat, is being absorbed. How do you read an omega-3 index? It is by percents. If your omega-3 index is less than 4%, you are considered high risk for cellular inflammation. If it is over 8, 8 or greater, that is optimal and considered cardioprotective. Now, data shows that people below 4% have higher risk of sudden cardiac death compared to people who are over 8%. Now, I use this in addition to all the other tests I talk about. Okay. I want to know about a lot of times you guys want to know, and I want to know as well, how much inflammation do you have in your body? And you check the um, high sensitive CRP, HSCRP. If it's less than 1, you guys feel fine and dandy. But what if you have a normal high sensitive CRP, but your homocysteine level's high? That's inflammation. What if your insulin level's high? That's inflammation. What if your omega-3 index is less than 4%? That's inflammation. So there's many things to look at. You can get an IL-6 interleukin, you can get a TNF alpha. There's a lot more tests to check for inflammation than just one. I'm just talking about another one. If you have an omega-3 index of less than 4, yeah, that's inflammatory. What's going on? Could you have too many omega-6s. But you could have a normal homocysteine, a normal insulin. You could be metabolically in great shape, yet your omega-3 index is showing signs of risk. We evaluate it and we go on. Okay. Question from 95 LT1. What foods got magnesium? I think you could probably look that up. I don't know what you're eating, you know. So that's something simple that you can look up. I don't know what exact foods have the exact amounts of magnesium and what kinds of magnesium. Jay says red clover tea is healthy for you? Question mark. Well, if you want to eat a plant from our ground and soil, then drink some red clover tea. What is it that it's healthy for? Give me that. I don't know anything about red clover tea. You say it's healthy, but what is it? What is it healthy for? Okay. We miss any questions over here on Instagram during my classroom session talking about omega-3s and polyunsaturated fatty acids? Um, I think that you guys are getting the hang of it, but just as a reminder, if you want to know your omega-3 level, ask specifically for a red blood cell RBC omega-3 index. Have your doctor search on that. You have to be specific or you will get a serum or plasma level and it won't mean anything to you. Even though the essential fatty acid profile, C12 through C22 sounds comprehensive, not for you, it's not. It's not giving you enough information. And it could be falsely normal and give you a false sense of security. Um, yeah, Jay, I don't know. It's for your liver, but what is wrong with your liver? My whole premise is, why do we take something to heal our liver, for instance, in this scenario, instead of removing what is causing a problem in the liver? I am wanting you to prevent the liver from ever needing to take in red clover tea or tudka or whatever flush you guys want to do. You need to remove whatever is causing the liver problem in the first place. It is important to know your diagnosis in everything so you can move forward. Too many of you are just looking at all of these supplements and trying to take them to protect you or to remove a problem, and you haven't really removed what is causing the problem. Make sense? Lucy asks, what are the other two inflammation markers we can check? Yep, IL-6, interleukin 6. And not many people do check them, Lucy, so that's why you probably haven't checked them, your doctor, or you haven't thought about it. But IL-6, interleukin 6, TNF alpha, homocysteine, insulin, a high sensitive CRP, and the omega-3 index, the RBC omega-3 index. Those are important, I think, inflammatory markers. Okay? Important inflammatory markers to get. I understand that learning about polyunsaturated fatty acids, monounsaturated fatty acids, and saturated fatty acids can get complicated. I can understand why doctors promote polyunsaturated fatty acids or mono for that matter, because mono and polyunsaturated fatty acids lower LDL. And we get because we have been ingrained in us to lower LDL when we maybe don't need to, or why do we need to? We get a false sense of health whenever our LDL is at a number that whoever it is, elitist or whoever, the three-letter agencies, tell us that the LDL is okay. However they got to that conclusion, I don't know. But simply looking at an LDL is not the magical answer that is going to prevent you from having the number one cause of death, which is heart disease. There's so much more, you guys, but yet you hyper focus on LDL. And again, I understand it, but I don't. I used to be the doctor that was hyper focused on LDL. And as many of you listening recall, you know that I came from being one of those doctors to not being one of those doctors. And had it not been for patients sending me things and saying, "Doctor, I really think that you should look into this. You might have it wrong." But I had to have some openness to take their suggestions and run with it. That is an ego problem. If I am able to be my brain to be suggestive, so a patient can suggest that, I have to be open-minded to look into it. And at first, I was a little resistant, I'm not gonna lie. But over time and more reading, I found that these patients were right. I believe they were right. So it's almost like I didn't really flip a switch, but maybe I flipped a dimmer switch and it was real dim. And then it gets a little brighter and a little brighter and a little brighter. And then all of a sudden you jump out of um, the matrix. I call it the matrix. Out of the suggestibility or the indoctrination that LDL is the cause of all harm and cause of all heart attacks. You guys know that that's not true because some of you who have had low LDL have still had a heart attack, or you know somebody who had low LDL, was on all of the medicines and still had a heart attack. So you know that it can't all be just LDL. There has to be some sort of inflammation going on. Something had to have damaged the arteries, caused inflammation. Why are we even checking for inflammation? Yes, Lucy, a ferritin level. I did forget that one. Thank you for adding that to the markers to check. I appreciate that. And it's TNF, Frank, not TNK, just so you know. Let's see. Some questions are coming on. Boom, boom, boom. Hold on. Okay, so we answered Lucy's question. Jay says, I just want to flush. Well, then go flush, I guess. Go flush out your liver. But flushing it out one time could be harmful, and it's not going to fix whatever is causing it to go bad the next day. Just flushing it isn't going to make any bit of difference, to be perfectly honest. You need to take away whatever is injuring your liver. If that's alcohol, take it away. If it's fructose, take it away. If it's glucose, take it away. Something is causing the liver problem to require to be flushed. Let's see. Errol, I'm sorry I can't answer your headache question, but I would definitely talk to your primary care doctor. Bill says, my doctor calls my liver problem MASH, metabolic associated steatohepatitis, and says lose weight. I have lost 50 pounds, but this is where the doctor stopped. Okay, not all weight loss is going to get rid of your MASH. MASH, metabolic associated steatohepatitis, or non-alcoholic steatohepatitis, is caused by three main things. Well, not alcohol because it's non-alcoholic, but that is a cause. Fructose and glucose. By removing fructose, glucose, and alcohol, you will burn off fat around your liver. MASH is visceral fat built up, choking your liver. Eventually, MASH can lead to fibrosis, hardening of the liver, and fibrosis can lead to cirrhosis. death of the liver. If you put a blanket around something and you smother it, it will die. If you put a layer of fat and we give it a name, MASH, you don't just lose weight. You have to lose visceral fat. Losing subcutaneous fat or losing weight on a scale. Thank you, Lucy. I appreciate the gift. You guys, any gifts you guys get that you give on YouTube is very appreciative. It makes the channel go. So super chats and super stickers make it go. And I appreciate your trying to support the channel. You can also support the channel by hitting the clicks or hitting the thumbs up on YouTube right now. Hit the thumbs up, please. Let's try to get up to 25 thumbs up right now. We're at 11. I know you guys can do it. Hit the thumbs up right now. It's a challenge. Okay. Live, love, dreams, just diagnosed with chronic liver. They said no preservatives, processed, a no-go. Live, love, dreams. The three main things that are causing your fatty liver or chronic liver disease is glucose, fructose, and alcohol. Processed foods full of seed oils, which are the polyunsaturated fatty acids, omega-6s that are inflammatory, are linoleic acid. Okay, omega-6 linoleic acid is in processed foods and it drives one of the drivers of fatty liver, but so is glucose and so is fructose and so is alcohol. So in order to get rid of your chronic liver disease, which I believe it can be reversed, get rid of those three things. And if you get rid of those three things, then you probably will not be eating processed foods, which is anything that comes in a box or a bag. They're processed. They are usually plants. They are plant foods that have omega-6, linoleic acid. Industrial seed oils, corn, cottonseed, canola, sunflower, safflower, soy, rice bran, and what is the other one? Grapeseed. Absolutely none. I don't care what your LDL is. You need to get rid of it because your liver can't process your cholesterol slash triglyceride slash LDL because your liver can't process it. Your liver sucks. Okay? The liver is the master organ. It is a master organ for a reason. And we treat our liver like crap. And I'm trying to get you to help it. It's struggling, it's strangled, it's suffocating in its own fat. It is making its own fat because of the things you feed it. It doesn't know what else to do with it. It's trying to package them all up into a VLDL. It is trying to package the fats that it has wrapped around it into a VLDL. A VLDL is full of triglycerides and cholesterol, and then the liver kicks it out into the bloodstream and hopes that that VLDL will deliver triglycerides and cholesterol to cells and tissues wherever, all over the body where it's needed. But if our body is full and resistant to any more energy, then those VLDLs hang out in your bloodstream. And we measure them either by getting a VLDL level or a triglyceride level. They are almost 1-to-1. A VLDL carries triglycerides. High trigs equals high VLDL. High VLDL means you have high triglycerides. Those fats are killing your liver. Just like that. Hi, Purple Flower. Thanks for being here. Yes, please hit the thumbs up. I appreciate that. We're almost there. We're at 18. Can we get to 25? Live Love Dreams says starting to juice. Juice what? Using Combram Estate olive, grass-fed over grain-fed, wild caught over farm raised. So, okay. How to flush your liver. Again, you guys, I don't think it's safe to flush your liver. He's already under a lot of pressure. You don't flush him with whatever things you're going to flush him with, hoping that he's going to be fine and dandy. That would be a stress and a trauma. We need to remove whatever is causing his problem. Juicing, I don't think it's the answer. Live, love, dreams. I don't know what you're juicing. Just olives? You're just juicing olives. Why not eat the olives? Those are monounsaturated fats. Why don't you remove whatever is causing your liver to be congested? I am Mawan. Does fenugreek seed help with the liver? I don't know. I'm not into supplements trying to improve my liver. I'm into removing what is the cause of my liver problem. Okay. And I want you to be into that. I don't want to push a bunch of supplements on you guys. I want you to live without supplements if you possibly can. Good morning, Viviana. Thank you for being here. Lockwood says, who decided what a standard blood test should include? Why do they leave out the tests you recommend? I can only speculate, Lockwood, what the answer is to that, but I have no agenda ordering the extra labs because I want you guys to know what's going on in your body. But if I can hide something from you, I don't want you to know what inflammation you have in your body because I'm promoting you to eat inflammatory foods. The agencies, if you look at the ADA and look what they promote you to eat, even in a diabetic, they're promoting you to eat how many servings of grains and fruit when you already have fatty liver? You have diabetes, you have fatty liver, trust me. Why would you continue to eat the very foods? Oh, so you can continue to be sick and you can continue to take the medicines that the doctors are all too willing to give to you. Why? Because that's their job. You have a diagnosis, I have a medicine, I give it to you, and I pat myself on the back for saying, well done. You made a diagnosis and you gave the medication. Well done. I'll see you back in 4 months. Let's do it all over again. Check your labs. Well done. Your labs look perfect. The piece of paper looks perfect, but yet you are obese or you have a pregnant belly or you have skin tags all over yourself, or your eyes are going bad, you're aging, you got a bunch of wrinkles on your skin. Seriously, at some point, you got to wonder, why do you keep going back to somebody who's just going to give you a medicine after they make a diagnosis? Is that the cure? No. Is there always a cure? No. But could you reverse a majority of what you guys got going on by your diet and your exercise routine, your sleep routine, getting outside in the sun? I think yes. Your doctor, MD or DO, I am a DO. I went to osteopathic medical school. I took an MD residency and I took MD boards. I'm a mix up. I'm a mix match. Okay. It doesn't matter. Our training was exactly the same. Make a diagnosis, give a prescription. It's not that we have been, how do I say it? We haven't been, it's been suggested to us over years that this is the process of being a doctor. Make a diagnosis, give a medication. Is it a cure? No, it's never a cure. It's never a cure. It prolongs things. And When I make a diagnosis of high blood pressure, I give a blood pressure medicine. It could mean 2 or 3 blood pressure medicines. If the guideline says that you have high cholesterol, I give you a cholesterol medicine. It could take 3 or 4 of them to get you to the goal that they say is the goal, whoever they is. Somebody along the line made up these weird numbers that we're supposed to follow. Doctors are supposed to follow, and we do it like little robots, like little Pavlov dogs. Okay? It's it's unbelievable. I almost wanna kick myself for not using my brain, but I didn't know. And I know that is not an excuse. I am a doctor, okay? I should know these things, but the training is like blinders, and they keep you going down this silo, and it is hard to get out. Because we didn't know. If I hide all of the knowledge and only give you what I want you to have, says the powers that be, I'm going to make you into what I want you to be. If I don't teach you about diet, which they don't, then you're not going to teach the people. If I teach you what medicines to use in a particular instance, you are going to write a prescription for the medicines. And you're going to encourage us to give up on you. I did. I knew that you shouldn't be eating carbs, that you should keep them to a limited because everybody who ate carbs was getting diabetes. And then you had high cholesterol, and then you got depression, and then you got kidney disease, and you got liver disease, and they all got a medicine. They all have a medicine for you. Every one of those things I just mentioned. And they treat them in little systems. And you go to the heart doctor and the lung doctor and the gyne doctor and the urology doctor and all. They did that all on purpose to get you thinking in silos. Do you think that the heart doctor talks to the lung doctor who talks to the primary care doctor? No. They might send their little notes. Do you think if I'm seeing 40 patients a day, I'm going to be able to read every note? I just put my little initials on it. Scan that, Denise. She scans it into your chart for safekeeping. And I continue doing on and on and on what I was supposed to be doing, I guess, writing prescriptions. I probably missed a whole lot of questions in here how much weight do you give to a coronary calcium score test evaluating risk of cardiovascular events and inflammation? I give it some. It's a screening tool. I give it some weight. I do give it some weight. But if you have high LDL and you have a high calcium score, I want to know more. Do you have soft plaque? I might want to get a CT angiogram with a Clearly or some other AI evaluation. I want to know an NMR, a nuclear magnetic resonance. I want to know your particle size. I want to know how many oxidative LDLs. But you know where it first starts? I want to know what you're eating. I want to know what you're eating. A calcium score will tell me that you've probably eaten crap for the last decade at least. Okay? You calcified some sort of soft plaque, but how much more do you have? How much more soft plaque do you have? I don't know without looking. I want to know if you're diabetic. I want to know if you're pre-diabetic. I want to know if you're insulin resistant. I want to know what your thyroid is doing. I want to know all of these things, and I don't need to send you to an endocrinologist and a cardiologist and a lung doctor and a urology doctor. I don't need it. I want to check them for myself. If I think that I need you to go see somebody, I'm going to recommend it. If I reach my limitations, you have to, as a primary care doctor, you have to know your limitations. But primary care doctors give up way too soon. They kick your bucket down the line. They don't want to deal with you. They don't want to deal with your diabetes or your eyes or your ears. They want to basically see colds and get you out of their office. They want 5 minutes with you and you out the door. Oh, we'll get some labs. We'll call you in with the results. Oh yeah, everything looks great because you're in the reference range. Keep doing what you're doing. Really? Keep eating processed foods and not exercising and sitting in front of your TV? Okay, keep doing what you're doing. You look wonderful on the reference range on a piece of paper. You guys, you are so much smarter than that. That's why you're coming here listening and trying to learn. And I appreciate that for you guys. So if you have a further question on that, Casey, let me know. I know it was kind of a generalized question, but the answer is I probably do need to know more information. Lockwood says my friend had a normal cholesterol and had major blockage, had a heart attack and bypass, died a few years later. So something led to over and over and over plaquing, to a blood clot and a soft plaque forming. Something caused it. You know, it wasn't. He didn't just need a statin. He needed to remove what was causing the problem. Hopefully, you guys, it's making sense to you. The minute we go to the doctor, you know what always, you know what bothers me a little bit is that your employer who pays for your part of your insurance is kind of in bed with the insurance company. You know what? They it's almost like they have this unspoken relationship, and they encourage you to go into the doctor and get tested or get a wellness exam, and then they give you an incentive. If you go get the wellness exam, then I'm going to give you some points. I'm going to give you a little Visa gift card or whatever it is. I'm going to take off your insurance, and you guys happily go running to the doctor. I'm not completely opposed, but hear me out here. And then the doctor seeing you is likely going to make you become a lifelong patient of that diagnosis, requiring medications. I'm not telling you not to go to the doctor, but I think you need to keep in reasonable logic of what is being ordered. Most of you guys know what to order and why. You don't rely on the doctor to interpret it. They're going to look at a reference range and say, you're A-OK, give you the thumbs up. I'll see you in a year. And you guys know better because you're starting to question things. You're questioning what has been going on the last few decades, the last 50 years. Allison says doctors don't order those labs because they don't know what to do with the results. Absolutely. They have a condition of ignorosis, a condition of ignorance. I don't give that diagnosis to them lightly, but they're proving it, right, Allison? I mean, they prove themselves every single day. They won't order it, even if you ask them to, even if you said you will pay for whatever insurance does not pay for, they won't order them. Why? They don't want to admit their ignorance. They don't want to lower their ego. They don't want you to be in charge of your own health care. Why do they want to control you? I don't know. I don't know why I wanted to control the patients. Maybe because I thought I knew best for Allison and every other patient. I knew best. Listen to me. I know best. I know what's best for you. Really. That I didn't even realize was ego. I felt compassion and empathy for my people. And I said, if they would just listen, I don't do it anymore. I don't do that anymore. I just give you information and I let you guys make a decision. I don't want to give you any recommendations. It's not, it takes way too much energy for me to give you a bunch of recommendations to do this and try to control you and say, if you eat some pizza tomorrow night, it's doomed and you might as well just give up. Well, it's not that easy. But if you're doing it every single day, now, you probably know if I tell you all about polyunsaturated fatty acids and linoleic acid, and I tell you about inflammation, and I tell you, and I connect all the dots, and we say, well, no wonder you have a calcium score. No wonder you're at high risk for a cardiovascular disease. Well, then you have to say, I think I want to undo this. Okay? You guys have to take the information. If the information goes in one ear and shoots out the other side, It's not on me. I gave the information. But if the information goes in and kind of wiggles around up there for decades and doesn't quite go out the other side and you didn't do anything about it, I'm not responsible for that either. You are. You're responsible for your own health. And you put a lot of your credit goes to the doctor. You're giving the doctor way too much credit. Casey says, in your opinion, what is the primary cause of high blood pressure? Insulin, high insulin. What is high? Anything over 5. You remove the insulin down to 3 to 5, and you're magically, if you've just recently been diagnosed with high blood pressure, now if your arteries are so hard and they lost collagen and elastin, they're no longer dynamic, I might not be able to, or you might not be able to improve your high blood pressure by lowering your insulin. I don't know. Can arteries heal? I think yes. I think yes, but that would like say maybe we could stop their aging. No, because we can't stop us aging. We're aging, our arteries are aging, but we can slow down the aging, slow it down to a turtle crawl instead of a rabbit crawl. Okay. Lockwood says the ancient Greeks said, let food be your medicine. I don't know if I ever learned that. Let's see. Clad, I think it's Clad. My calcium score had a score of 0, but my cholesterol is 280. My trigs 280. My doc wants me under statins, but I said no. I'm making changes in my eating. I asked her to send me a fasting for a fasting insulin, and she said it's not necessary. Well, okay. In all reality, Clad, I mean, let's just be honest. Is your insulin with the numbers you gave me, is it necessary? Nope. It is not necessary. It might be necessary for you to get a number and say, uh-oh, it's 20. I know where to go with it. But honestly, your triglyceride level of what was it? 280? You are a diabetic. That is diabetes, and you have fatty liver disease. In order to reverse that, you need to get rid of everything that raises triglycerides, carbohydrates, alcohol. That includes fructose and glucose. That includes most plants. All plants are carbohydrates. That's all they are. So, do you need an insulin level? I'm not defending that doctor. She didn't even know what it was. She probably didn't even know what it was. You do. You think you need it. You do. I mean, it would be nice if you had it. You can get it on your own. You can go to Ulta Labs. I can order it for you. You can go to Life Extension Labs. You can go to any online, pay $10 and get an insulin level. And it will be high. It will be over 5. Your triglycerides are screaming. Your liver is choking. You have a choking liver. Knowing the insulin number is not going to unchoke your fatty liver. Okay? Okay. Okay, where we at? Lucy, where we at here? I got a lot. Please put a question mark in front. Good morning, purple flower. Okay, I think that's where we're at. Yes, please hit the thumbs up. We went over 25. Can we go to 30? We're almost there. Thumbs up, you guys, on YouTube. Please hit the thumbs up. Okay. Jeff says, do you know anything about the nutrition to help coming off prescribed benzodiazepine withdrawal? Thank you. Do I know anything about the nutrition? Getting into ketosis, according to Dr. Georgia Eid and Dr. Chris Palmer, would be in your best interest to learn. They actually have classrooms that you can join. They are psychiatrists and they follow a prescribed ketogenic diet in order to help psych problems. I've seen many of my psych patients on a ketogenic diet get off of their medications. You need to be weaned off of your benzodiazepines because they do cause withdrawal. And Jeff, your primary care physician, or going online and going into their classrooms and becoming their patient, they can help you wean off. Dr. Georgia Ede, EDE, and Dr. Chris Palmer. Clad says, thank you. I was diagnosed with fatty liver. Well, there you go. High triglyceride of 280 is fatty liver, but your A1C is still 5.3. Amazing. You have a body that is still dealing, struggling, but dealing with a crapola diet that's causing a fatty liver. And eventually your A1C will register over 6.0 if you were to continue doing what you're doing. The socket says, what if you can't remove it? What's it? Some need painkillers, etc. I'm not sure what that means. How do you remove the problem from the liver? It's your diet. It's your diet, She Natural. Whatever you're eating, if you have fatty liver, it needs to be reversed. I am, yes, they have you take medications instead of healing naturally through diet. They don't even know what a natural healing naturally means. We have been taught allopathic medicine, not natural medicine, allopathic. That means make a diagnosis, give a medicine. That's allopathic medicine. Exactly, Dr. J, says Purple Flowers. Been 19 days, developed shingles in my back, right leg to the foot, which is painful. I suffer with myeloma and can't bear weight. Taking Isaac. Okay, I don't see a question in there. Sorry, Elizabeth. Ira says, what does your diet consist of? Beef, butter, eggs, sardines, and a few monounsaturated macadamia nuts, like 7 to be exact. And that is new. I eat all kinds of beef. I'll eat deer, bison, buffalo, sheep, lamb, mostly beef. I'll eat grain-fed and I eat grass-fed. Is the brain 90% cholesterol? I think that's something you can look up, Live, Love, Dreams. I'm sure the percentage is pretty high. Jack, Jeff and I want to know if there's particular nutritional strategies. I think I just went over that alleviate symptoms associated with benzo withdrawal, a ketogenic diet. But like I said, hook up with Dr. Georgia Ede, EDE, and Dr. Christopher Palmer, Palmer. Live, Love, Dreams. You're being treated for hepatitis C, and that's what caused your chronic liver disease. I'm not sure what you're asking. Summer Love says, I've been wanting to get into the medical field and have a promising career, but it's pretty discouraging knowing that you're a part of the problem and not a solution like you're supposed to be. That's true, unless you go to a different type of medical school, learning naturopathic, learning natural ways. But again, you get yourself into problems because your natural ways through a naturopath includes taking supplements. There are not very many doctors who deal with root cause. I was not one of them up until about 3 or 4 years ago. I was not one of them. I said, forget it. I make a diagnosis, here's your medicine. You're not going to do anything about it. I tried. I'm done. You guys, you are the ones eating the food, drinking the drinks, alcohol, doing the thing under the blue lights. Don't get out in the sun. Work, 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 work. Run your kids to the events. You don't relax. You don't pray. You don't, all of these things. You don't sleep. You think that you can live on 5 hours because you feel great. Well, then you feel great because you drink a bunch of caffeine. and you do all kinds of other things. We do this to ourselves. And then we really end up blaming the doctor. And it's fine. I've taken a lot of blame, but honestly, we didn't cause your problems. And you came to us. You paid your insurance and you came to us. We gave you a diagnosis and we gave you what we think is the best option is here, take the medicine. But since I'm done with that, you guys still come to me. I make a lot of diagnoses. I tell you what's going on that your doctor missed or likely just skipped over because they didn't know or didn't even want to talk to you about. And they say that you're normal because you fit into a reference range. Reference ranges now include a bunch of sick people. The whole 90% of the population is sick. So the reference range is an average of all the sick people. If you're a healthy person and you fall out of that range, then you're basically really an oddball, and then you wonder what's wrong with you. There's nothing wrong with you. I wouldn't want to be inside that reference range. For instance, an ALT goes all the way up to 45 usually on a reference range. Well, honestly, that's 4 times normal. A 45. What's normal? 10 to 15. And the reference range says you're okay. You're not okay. If you have a 29 ALT, you're not okay. An okay would be 10 to 15. A 29 is not okay. Well, Dr. Jensen, it says I'm in the reference range. You are in the reference range. If you want to be as healthy as all the other sick people, then you fit in the reference range. I don't think that's where you guys want to be. That's why you're listening to people like me and others online. But here's the difference. I don't want to sell you anything. I do not want to sell you any supplements or any programs or anything. But if you come to me and you sign up for a consultation, you email me at ironladydoc@aol.com, you sign up for a consultation, we're going to go over everything. I'm going to pick out things. I'm going to fine comb, detail every lab, your diet, your sleep, your everything, and I'm going to try to connect as many dots as I possibly can and give you that information. That's what I do now. I'm not responsible for writing you prescriptions, nor do I want to. I think many people can fix all of the things I find without going to the doctor. Okay? Without prescriptions, but you have to change your lifestyle. It's on you. Mary says, I'm a triathlete and I carb load 48 hours prior to half Ironmans. And fructose and sucrose gels, carb drinks for high intensity. What negative impact does that have on my muscles? You know what? You are causing extreme blood sugar fluctuations. You are glycating yourself. You are doing chronic endurance activities. I did 2 reels this week, Mary, on the athlete's paradox, which describes extensive calcification in the coronary arteries in endurance athletes. Is that calcification a problem? Likely not. It is an adaptive mechanism to calcify all of the injury that you have been doing to your coronary arteries. The injury is constant pressure and volume from doing endurance activities. And then you blast yourself with some sugar and insulin that causes more irritation. Can you do your endurance activities on a ketogenic diet? Yes, but it will take you a year to adapt and get your times equal to where you are right now because your body is addicted to sugar and you think that you need sugar in order to perform your half Ironmans. That's a lie that you've been told. And so you would rather blast yourself with a bunch of sugar and gels and fake crap in order to give yourself a quick energy blood sugar rush that really only your brain can use. And then your body will secrete a bunch of insulin to bottom out your glucose. And then you hit a wall. And then you think that you can maybe recover by taking in some more gels, some more carbohydrates. And honestly, There's a reason why people could be better on their times, their endurance things, but, from what I have learned, I I would never, ever do another endurance activity again. I think that the low pulse is a lie. I think athletes who think their pulse that 35 or 40 is a badge of honor and it is good for you. It is not. You've been told that. Your doctor probably patted you on the back and said, "Oh my gosh, you're in such great shape. Your pulse is 45. You're awesome." No, you're not. Today's true sports cardiology shows that decades of continuous cardio volume and pressure is permanently downregulating your ion channels. It is ruining your pacemaker cells in your SA node. They are getting worn out by the constant high volume and high blood pressure. Your heart muscle is also doing the same. It's enlarging. You are losing the electrical system in your heart over time. And you will end up, worst case scenario, with sick sinus syndrome or a complete heart block. You might get AFib. You likely will need a pacemaker at some point because you are destroying, damaging your own natural pacemaker cells due to endurance activities. Now, I'm not slamming in endurance activities. I'm giving you the progression, the recipe for what you're doing in the future. And you have to decide whether you want to continue that. But you need to get a, a heart rate monitor and check your heart rate in the middle of the night. If it's dropping below 30, you need to see your doctor and get a Holter monitor and wear it for days. And you also need to get a fibrosis screen on your heart. It's a special MRI or CT scan. I cannot remember. Now that I don't think I wrote it down anywhere. I can't remember. But you need to check for myocardial fibrosis. It's a special test. It's a special scan that will determine how much fibrosis, hard scarring you have caused in your heart. Can some people withstand it for the rest of their life? Yeah. So can some people withstand a low LDL, a high LDL, or whatever else it is? Is this standard across the board that Mary is going to get signs of sick sinus syndrome and calcification? You know what scares me, Mary, is that you go to your doctor and you say, "I want a calcium score," and that calcium score is 300, and they send you to the cardiologist, and the cardiologist sends you to a um, angiogram, and they stent you when you don't need to be stented. They stent you because your calcium score was so high. So you're getting procedures done to you that you didn't need. Your blood flow is fine if you've been doing endurance activities for a long time. Your arteries have actually widened even with all of that calcification, that protection. Your plaque is harder than somebody else's plaque that they've been eating what Dr. J describes as a crapola diet. But Mary's calcification is going to be much higher and thicker and harder. Her blood flow is likely fine because she's also got collateral blood flow, all the little branches of arteries feeding her heart. What Mary doesn't know is her heart doctor is going to angiogram her and stent her when she didn't need it. And now it puts her at risk of more bad calcification at the tips of those stents. When all Mary needed to do, which you guys aren't going to like to hear this, is see the cardiologist, get the myocardial fibrosis scan. If it is showing that you have scarring, you need to quit. In fact, maybe quit before you get the myocardial scarring. It's hard. If I was a lifelong athlete, triathlete, runner, the high you get, I'm guessing it's amazing. But honestly, my heart, it is not getting any better. You've been lied to. It is not healthy. People, the primary care doctors say, "Wow, oh my gosh, you're in such great shape. Your heart rate is so low." And we would give it a diagnosis of of good vagal tone. You have high vagal tone. You're relaxed. You're not relaxed. You are actually under chronic sympathetic, not parasympathetic, sympathetic stress. Your heart is not conditioned. It is not relaxed. It is downregulating important channels, and the chronic high blood volume and high blood pressure over time, decades probably, could be the cause of your heart attack. And the heart attack is not because of clogged arteries or a blood clot. It's because you went into VTAC or VFib and you died before somebody could defibrillate you. Your first sign, dizziness, low heart rate, syncope, blacking out. Those are the signs. So as you gel yourself with the fructose and the glucoses and do all the thing, you're causing yourself to have diabetes, insulin resistance, hyperinsulinemia. Minding my keto. Should I continue with keto post-appendectomy? Why wouldn't you? Why is a keto diet okay before you when you have an appendix, but it's not okay when you don't have an appendix? Why is your appendix so inflamed they had to take it out? Casey says, I was a long distance runner for many years and I have very low resting pulse with cold extremities. I haven't done any long distance running for 10 years, but my pulse has not increased. What do I need to do? Your heart needs to be checked out. You need to do a Holter monitor. You might need a pacemaker. Eventually, the very few pacemaker cells that you have left in your SA node in the right atrium will disappear. And then you'll have a symptom, and then you'll rush to the emergency room, and then they'll put in the pacemaker. But be proactive. Your pulse is low. That means your pacemaker cells are not working. They're strained. They're done. And eventually, you will go into an arrhythmia. That is the likely, I'm not saying it will happen, but that is a likely path. It's a likely path. Okay? You need to check for myocardial fibrosis with a scan. Myocardial fibrosis. I don't know if I have it down. It is called, yes, it is called a cardiovascular MRI, a CMR, cardiovascular MRI, MR, magnetic resonance, cardiovascular C, magnetic resonance. Okay. And they do it, especially need gadolinium. Do you want gadolinium? Likely not. But in this instance, in order to see if you have myocardial and myocardial fibrosis, you need late gadolinium enhancement. Late gadolinium enhancement. You need a special cardiovascular MRI called a CMR. CMR, cardiovascular MRI. Minding your keto. I meant it was inflamed. Your appendix was inflamed, maybe through dehydration, doubtful. Immediately after surgery, you don't know what to eat. Would you go and eat a bunch of inflammatory carbs as opposed to your keto diet? Answer the question yourself. You know the answer. Why does it matter if before you did surgery, you were keto? Why would you add back inflammatory carbohydrates that will slow healing time after your surgery? You know the answer. You know the answer. Oh yeah, I forgot that, Lucy. I do drink coffee. And I do have about an ounce or 2 ounces of cream every day. And you know what? I also forgot I eat a half a cup of cottage cheese every day. I do now. These are additions. I didn't eat the macadamia nuts, 7 of them, and I didn't, or was it 5? I think it's 5 or 7. I can't remember. And then I do eat a half a cup of cottage cheese a day. And yes, Lucy, please add a QQQ or do a super chat. It helps the channel. I appreciate that. Help, do super stickers. It helps my channel. Okay. Jeff says my doctor has absolutely poisoned me. It's quite possible, but you accepted it. You were part of the solution. You made a decision, right, Jeff? I mean, we didn't tie your hands behind your back and pour whatever it is down your throat. You you chose the thing. If I'm a doctor you come to see and you you have a diagnosis, I'm going to suggest a medication. You have to actually take the medication. It's you. I didn't force it on you. I didn't do anything. 1856 says calcium supplement. Can it increase stone formation if you don't drink enough water? Don't drink enough water. I don't know about yeah, I mean, of course, but it doesn't mean that you need to drink a gallon a day. But why is a calcium supplement going to be a problem? What if you don't take a calcium supplement? What if you take a vitamin D supplement? If you take too much vitamin D, you're going to cause your gut to reabsorb calcium. So most of the time, people who have calcium problems is because they take vitamin D in excess. They don't need it. Another thing is that the most common kidney stone formation, I'm guessing you meant kidney stone formation, is eating too many oxalates. Where do you get oxalates? Plant foods. What do oxalates bind to? Calcium. You get the most common cause of kidney stones is calcium oxalate. Calcium oxalate stones make up about 80% of all kidney stones. Oxalates. Oxalates are in plants. Phytates are in plants. Calcium oxalate stones has nothing really to do with water, has everything to do with your diet. Oh, Michael, welcome. Michael is from Rocky Point, North Carolina. Where else are you guys here from? I am an osteopathic physician. Thank you. Stu says, don't you think allopathic medicine is excellent in the acute setting? You mean if your finger gets cut off and you need a doctor? Absolutely. Like when, like I get what you're saying as far as preventative, but you can't get to prevention unless you address acute issues. You don't have an acute issue, you have chronic issues, you guys. Chronic issues, things that have been with you for decades. There's nothing acute about it unless you have a need for a hip replacement or your finger being stitched back on, or you cut yourself and you need it stitched up. Those are acute things. You have a urinary tract infection. That's an acute thing. Do you think that a doctor treating your acute situation is going to spend time talking about your chronic situation? Doubtful. I didn't have time. I didn't have time. And many of you who are talking to me for consults, their doctors didn't have time either. So, again, there's a time and a place for a doctor. I'm not going to disagree with that. But if you guys want to know what is the best doctor to have, look in the mirror and it's the person staring back at you. You guys know more than really any doctor I know. Okay? You guys are learning more than any doctor who has ever went to medical school, like myself. I didn't 4 years ago. The stuff I'm talking to you about, I did not know. We didn't need to know. I made a diagnosis. I gave you a medication. I'll see you back in 4 months. Okay. Lucy says, I wish that we could go to a lab for healthy people so your lab range is compared to your peers. You know what, Lucy? We know the answer. It's the optimal labs, and we know what they are now. We're getting a better grasp on what optimal levels in the body are. Yeah, MJ, I would agree with you. It really is just a bunch of band-aids. Penny says, Yelp got me a pacemaker, Tacky and Brady. Yep, Penny. Now, an athlete like Mary could come back and say, people who get pacemakers are all old. I agree. I agree. But you doing endurance activities, you're aging your heart like a 70-year-old. So you're 30 years old and you have a 70-year-old heart and you just don't know it. So that's why your pacemaker cells ran out. They ran out too fast because of the constant volume and pressure over time. Volume and pressure over time is ruining your coronary arteries and it's ruining your electrical system. Yes, Cora, a fibrosis test, an MRI, a CMR, cardiovascular magnetic resonance with gadolinium with late enhancement gadolinium. Nin says, when you say endurance training, how long are you basically talking about? Okay, let me give you an example, and it's going to hit home. It's a personal example of my father who ran 7 miles a day, 8 miles a day, ran half marathons every twice, 3 times at the most. Just a jog. He might ran a 7-minute mile. I know you guys might think that's a lot. And when he raced, he ran a 6-minute mile. My dad ended up with what looked on the angiogram like complete blockages of 5 vessels. They took him to angiogram. Then they proceeded to take him to bypass surgery. And the doctor, I explicitly heard him say, Wayne, you're so very lucky that you were a runner and you have collateral blood flow. You didn't have any part of your heart die. Then why do you take my dad to open heart surgery? Well, while they were there, they put a pacemaker and a defibrillator in him because he, guess what? Undiagnosed, it is diagnosed by me now, he had myocardial fibrosis. He wore out his pacemaker cells. His pulse was like probably 30, 35 all the time. And he went into VTAC when they found him. It hits personal. So, do I consider my dad running 7, 8, 9 miles a day, 5 to 6 days a week for 40 years? You say, well, that's not very intense. No, it's not. Volume and pressure over time led to the exact things that I'm trying to warn you guys about. I don't care if I change your mind. I just want to tell you that this is a possibility. If you want to continue your endurance training and you think, I'm just going to do 3 miles a day, well, 3 miles a day, volume and intensity over time for 40 years might be just what your body needs to cause myocardial fibrosis. And over time, you constantly were building up calcifications. And on top of that, you were doing a bunch of gels and carbs. And you say, well, it doesn't bother me. I don't have diabetes. And so you just kept eating them until you can't. See, at first you're insulin sensitive until you're not, but you're building damage over time. I know it's a hard pill to swallow. Okay, Lucy had to go. What do I believe is ideal workout regimen for women as we age? How about for any age? I don't care how old you are. You should be lifting weights. Muscle is the organ of longevity. You need to find a trainer. You need to learn compound exercises like deadlifts and rows and presses and squats and lunges. Those increase your big body parts. The largest body part in your body is the gluteus maximus. The largest group of muscles is your quadriceps. You need to build muscle. Can you still do it at 35? Absolutely. Can you do it at 50? Yes. But you have to eat right. You have to exercise correctly. You have to sleep good. You have to get out in nature. You have to not drink alcohol and not smoke. I mean, there's a lot of things that go into it. So Iris says, so you don't eat fruits or vegetables? No, I do not. I gave them up 3 years ago. Jack says we accepted the meds because we were just as ignorant as the doctor who prescribed them. We trusted the doctor. And yes, yes, you did. And it's not your fault, you guys. We, I mean, in my time, the doctor was so well respected. So I wanted to be that respected doctor. I grew up in a tiny little town, and the doctors there, everybody loved them. Everybody wanted them to come over for dinner. They were at your softball and basketball games. They were at your volleyball games. They were everywhere. You saw them at the grocery store and you said, "Oh, hi, doctor. Hi, doctor." And we held them with such regard and esteem. But in the olden days, they were your doctor. They delivered your babies. They were your heart doctor and your lung doctor and your urology doctor and your gynecologist. They were your everything. And they would see a few patients a day. And it wasn't about money. It wasn't, did they make money? Yes, they made money. I mean, some of the long-term doctors, they had beautiful houses, but they were so giving. They were at all of the events, doing everything for free, kind of like what I'm doing now. But the doctors now, they're so brainwashed. The curriculum is changing. It's pharma. It's it's big pharma, it's big food, it's everything to keep you guys under their thumb. If you want to be under somebody's thumb, get involved with the going to medical school and being one of them. But it sounds like you guys want out of that matrix. That's what it sounds like to me. That's what I want. I want you guys to not really need to go to a doctor. Put the doctors out of business. I used to tell my patients, put me out of business, you guys. Well, they actually did, kinda. I mean, Denise, my nurse, did retire, so that kind of put me out of business. Okay. Rhonda is listening from Woolmarket, Mississippi, and oh my gosh, it's flooding down there. I'm so sorry. Flooding's, oh, that's the worst. Summer Love says, thank you for everything. You're very welcome. Elizabeth, if you have a problem with shingles, seriously, go to see your doctor, okay? I don't have any advice for that. Um, you know, I don't know what's causing your shingles. You got a lot of history with melanoma or myeloma, I mean, and high blood pressure, chronic kidney disease. You have, probably what's going on is you just have a functioning or multi-chronic disease problem. And, if you want to do a consult with me, that would be great. You can email me at ironladydoc, IRONLADY DOC at AOL.com. If you guys want to sign up for a consultation, I'm here for you. We can go over things. I can give you information in regards to your labs, go over them. I mean, line by line. I spend hours. If anybody is listening right now who has had a consultation, let us know what your thoughts are. And it's okay if you had a bad experience. I haven't had very many who say they've had a bad experience, although the bad experience might be I find something they didn't want to have found, and that's a bad experience. That is a bad experience, okay? And it's scary, but there's always a way out. It's just going to take you guys having to work hard at abiding by the way out, and it's usually removing the injury. That could look like food, it could look like poor sleep, it could look like alcohol or smoking, it could look like blue lights, and you got to change every light bulb in your house back to incandescent. It could look like giving up friends because they're a bad influence on you. It could look like you spending money to buy a gym membership, to buy a trainer, to show you how to work out. Yeah, people don't like to hear that what they've been doing for decades is leading up to their problem. And if they don't care, then you continue doing what you're doing. Okay? Just do what you do. And we're all going to die. You know that. Our bodies are going to die. Our shell is going to die. But me, I have eternal life. I am going to live forever with Jesus. That is what I signed up for. It's the contract I signed. I believe he's my savior. I'm going to live forever. He gave me this body. He told me to take care of it. He told me to share the gospel that Jesus was born, he was placed on a cross, he was buried, and he rose again. The gospel. He asked me to share the gospel on a daily basis, multiple times a day. He said, be the light, be the salt. And for that, he gave me this body. And he doesn't want us to just damage it, damage goods. You know what? It was a free gift, whatever. I'll just treat it bad. I don't believe that. I'm going to treat mine great. I'm going to do the best I can. And that means don't put fake foods in my body. What fake foods? Anything that has no nutritional value, anything that was made in a lab by a man who's trying to make you sick and give you the medicines. That's how this whole thing goes. So just because I believe and I know I'm going to live forever, does that give me the license to just treat my body like crap? No, I'm going to do the best I can. I'm not going to give it fake crap. I'm not going to be under the blue lights once I found out that it's all the EMF is destroying my brain and my heart and my circadian rhythm. The very thing that God gave me to be able to live this life and thrive and survive and share the gospel, somebody else is trying to take away. And I'm letting them, if I let them. I'll eat their food, I'll buy their bulbs, and they'll tell me the incentive is, I can save you $100 over a year. You know what? Stop buying Starbucks coffee and you'll save $5,000 in the year. Well, you know what I'm saying? They give you these tiny little trinkets, these breadcrumbs, like you're saving some miraculous thing. And, oh, we're going to save you so much energy if you just buy my LED blue light that messes with our brains. And then they'll sell you a blue light blocking glasses so they can sell you something else to block the blue lights that they sold you. We are not thinking logically, you guys, you know? And if you don't believe in Jesus, I'm not here to try to convince you. I feel very convinced as it is. And what I hope is that you say, man, I like what Dr. J is spreading. I want what she's got. Well, be honest with you, you're going to sign yourself up for a lot of trials and tribulations because that's what comes. It's not going to be all roses. Trust me. In fact, it'll be worse because before you were in bliss, just living in bliss. If I just close my eyes, it never really happened. Well, now when your eyes are open, everything starts happening. Okay. And that's trials and tribulations. And then you got to say, well, I guess this is what I signed up for. And I'm going to rely on God to take me through. And that's what I do through the trials and tribulations every single day. It'll never, and I try to talk myself out. Well, if I just had this, if it was just a little bit better, everything would be good until the next thing happens. So, Nin, I agree that endurance training sounds like a bad idea. Nin, to answer your question right off, I can see it coming. I don't know what volume or pressure Nin needs to push Nin over the edge and cause heart disease. I don't know if it's a half hour every single day. I don't know. In you, the pressure could go up in 20 minutes over 5 days a week for 40 years, 10 years, 20 years. I don't know. You could get high blood pressure walking on the treadmill, listening to a podcast, a political podcast, and that increases your pressure and the volume. And then maybe you didn't sleep the night before. And then maybe you had some pizza and you thought, well, I can eat whatever I want. My weight is fine. And then I don't know everybody's scenario. I'm just giving, if you are doing endurance activities over and over and over again, and the volume and intensity and your diet, every endurance athlete I know eats a ton of carbs. You don't think that blood sugar elevations, those spikes, and that insulin is not doing damage? Eesh, you know what? I think you have a blindfold on and telling you that you need to do 20 to 30-minute cardio sessions. There's nothing. Go for a walk outside. Go for a walk in nature. Hug a tree. Be in the sun. Spend 20 minutes praying, meditating, whatever you do to ground yourself, increase parasympathetic tone, and decrease sympathetic chronic fight or flight, got to get out of here situations. We put way too much emphasis on our jobs and not enough emphasis on our sleep. I mean, you guys know this. You know it all. I'm preaching to the choir. Summer says, I wish you would consider mentorship or being a teacher of sorts. I would love to be a student. You're amazing. You are a student. I am a teacher. You know, God gives each of us gifts. And what is your gift? Summer Love, ask yourself, what is your gift? Look up the verse where it talks about what gifts God gives. Some gifts are a teacher, some gifts are other things, but I think God blessed me with teaching. And he opened up a door for me to not teach in a school. He gave me a door to teach to 3,500 people online. I'm talking to myself in a camera. I can't see you. You can see me. I'm one person teaching to whoever will listen. Do I have all of the answers? Absolutely not. Is everything I'm saying the absolute truth? I don't even know. You guys don't know. And that's why I always say, I always go back. You guys will never forget this verse, okay? It's First Thessalonians 5:21-22. And it says, hold fast to that which is true, to that which is good. First Thessalonians 5:21-22. Test everything. Examine everything, you guys, carefully. Test everything. Examine everything carefully. Hold fast to that which is good and abstain from that which is evil. So hold fast to that which is good. Good is Jesus. Jesus is the truth. And abstain from everything evil. Satan, the man, the world. We are minions if we do not believe in Jesus as the truth. We are Satan's minions if that is not the case. So I don't know if everything I'm telling you about myocardial fibrosis is true. I have an experience. I have looked up things that could possibly go wrong in endurance athletics. I am an athlete. I used to play all kinds of sports. And now I just lift weights. And it's not just lifting weights. I lift. What do I cook with? Butter. Thank you for your honest answer, says Nanny. You're very welcome. And Kelly is going to sleep. Hey, get down. Tello. Tello is disrupting Buddy Blue. Casey says, is it true that low sodium diet is heart healthy? No. You're going to just take out a mineral? Your body needs salt. It needs the right kind of salt, but not Morton salt that comes in a process. You need real salt. And the only reason that salt could be a problem is if you have high insulin. Well, that's metabolic. You have high blood pressure because you have high insulin, not because of salt. You're retaining salt because you have high insulin. You're retaining water because you have high insulin. Get rid of the insulin down to an optimal level of 3 to 5, and you magically dump salt and water, and you replace it with good salt and good water. The water that you get rid of, pathologic water, it's called pathologic water, when you go on a low insulin diet at first, I've had people dump 7 pounds in a few days of pathologic water that was trapped in your body and causing problems. So when people go to a ketogenic diet, it's very important for them to increase their salt and minerals, not lower them. That's just another job of the doctor to say, here's your medicine, don't eat any salt. As you get worse, you get worse congestive heart failure, you get worse coronary artery disease, you get worse. But here's your more medicine. We'll start with this medicine, then we'll add some more medicine. It's called whack-a-mole medicine. Whack-a-mole. I give you something, you get diabetes, I give you A diabetic medicine, you get depression, I give you a depression medicine. You get high blood pressure, I give you a high blood pressure medicine. I got a I got a bag full of medicines I can give you. And I've been trained. I know exactly what medicine to give you. And it's usually in the right class and the right course. KC says, how can you naturally improve your pacemaker cells? Once they're gone, KC. There is no coming back, I don't think. I think when you damage your pacemaker cells, I just think that SA node, once it goes bad, it goes bad. There is no coming back. And in that case, you do need a medicine or a pacemaker. Okay? It it I think that you will find your demise if you don't take care of, treating the symptoms if you have no pacemaker cells left. Okay? Silja says, thanks for your constantly reminding that we need to take responsibility for our health. We have already trusted the system for too long. I agree. And the doctors don't even know they're part of the system. They're so ignorosis, they don't even know that they're part of the system. They don't know that they're being indoctrinated. They are clueless. I was clueless. If somebody wouldn't have slapped me in the face and hit me on top of my head, I would still be clueless. Indoctrinated, treating you the exact same way I learned to treat. I make a diagnosis, I give you a medicine. I didn't know about blue light. I didn't know about insulin levels. If you wanted an insulin level and I said, "What is that?" I know what insulin is. How do you gonna I go, "I don't know how to interpret that." "That's okay, Dr. Jensen, I'll sign a form." They did. I said, "Hey, I don't know how to interpret any of this. You want these labs? I don't know how to interpret them." "It's okay, doctor. I got a form right here. It says that you are off the hook. You do not need to interpret anything. Just send me the results." Okay, that seems easy. I protected myself from a lawsuit by you signing a form. I notarized it. Bam. I mean, seriously. But your doctors, oh no, they aren't gonna let you know that you know what you know and they don't know what you know. Their ego is not gonna say, "Oh yeah, I'll just here sign a form. I'd be happy to order whatever you want." And are you kidding me? Plus, here's another thing. When you go to doctors and they work for these big companies, these big hospital groups, they are incentivized by not spending money on your labs or scans. They'll say it's not necessary because in reality, the money, if you get an insulin level, even if it's paid for, it comes out of their pool of money. So they're actually paying for your labs, so to speak. I mean, not exactly, but kind of, okay? And so they're trying to preserve their pool of funds. Don't refer you, don't order the scans, don't order the tests, because at the end, they get to divvy up all of the pool. And it won't be spent on you, it'll be spent on them. At least that's the way it was when I was working in a hospital group. Then I went out on my own, and then there is no incentives. It's basically just spending money to see you. I spent my money to see you. The reimbursement sucked. Everything about it sucked except for I helped you guys. And so that made me feel good. And then that was the benefit. And I got to share Jesus to every patient that I saw. And I never had anybody walk out. They might have disagreed with me, but they didn't walk out. And they still kept coming back. That's called respect. I respected them, but I prayed for them, and I told them I was gonna pray for them. Does the myocardial fibrosis scan tell you the health of the pacemaker cells? No, your heart rate does, Casey. Two different things. You'll get a fibrosis scan to see how much scarring you have in your heart, and you'll also get a Holter monitor. If your heart rate is bottoming out overnight, even during the day, to less than 35 on a fairly consistent basis, your pacemaker cells are done for. Okay. It's just a matter of time. I don't know if you could stop. I mean, maybe God is so good, Casey, that your pacemaker cells, if you stop doing what you're doing, they'll regenerate. Maybe. God is so good. I haven't even remotely come close to all of his miracles. And I won't until the day I'm raptured up, okay? I won't know. And I don't know how to answer your question, Casey. I mean, in my head, I say, gosh, once they're gone, but maybe, just maybe God's got provision. I don't know. Maybe he's got provision for you, Casey. I don't know. Um, Tolly says, many thanks for your advice and honesty. You're the best. Thank you. Just hit the thumbs up, I guess. Do the, you know, do super chats and super stickers and all of that stuff. Support my life fundraiser for rescue, rehab, and rehome. Does the money go to me? No, but it goes to something that's really important to me, you know? And Tootie's birthday is tomorrow. I call her Tootie, but her real name is Tootsie. And Tootie, I'm gonna try to get her live on tomorrow. If she'll sit with me for a little bit and won't be crowded out by Buddy Blue. Yeah, I would love Tootsie to be here and to you honor her with a $1 donation to rescue, rehab, and rehome. I have 3 days left. I have 3 days to raise $100, and I have 15 raised so far from 2 different donations. So if you want that information, I can always send it to you. Yes, I'm talking about you, Talo. Yes, I'm talking about you. You go lay down. Go lay down. Silja says, some of my daughter's friends are studying medicine, and when I hear them talk, shows that nothing has changed. I would want them taking me in a hospital in case I needed to go there. Yeah, you want them to give you a ride if you needed it, but honestly, you don't want to go. So you got to prevent it. So that is where, you guys, I was so heavily into preventative medicine and I gave up on my dream. I gave up and let big medicine and indoctrination take over. I wanted to prevent people from getting illnesses. I always wanted that. My dad and I named my clinic Center Stage Primary Care. Center Stage Primary Care. Put yourself under the spotlight. It has analogy to me as a bodybuilder. If you put yourself under the spotlight, you're number one. You take care of yourself. And if you're healthy, you can take care of others around you. It would do no good if I didn't get any sleep last night, drank a 6 pack, smoked a pack of cigarettes, and then came online and I'm like this, and you're asking questions, and I go, I don't know what, if I don't lead by example, is my example the best? I don't know. I've made so many mistakes in the past 4 years, but I've learned from them and I've made some changes in my protocol, and I will share that with you guys. I have shared that with you guys. I'm still on a journey. I'm on a journey with you guys. We're learning. You're learning. I'm learning. We're learning together. We don't know the answers, all of them. We have some presumptions, we have speculations, we have hypotheses, but if everything was true and done deal, which they call science is never done deal, it's never written in stone, but we've been told that the science is legit, it's done. LDL is the cause of heart attack, lower LDL, and you won't have a heart attack. We know that that's not the case. We see it every single day in our lives. Virginia says keto carnivore for 306 days. Wow. 60 days short of 1 year. Pulmonary hypertension, fibrosis, heart rate is high when moving around. Is this normal? Got a referral to cardiologist. I do not know. I would need a lot more information, a lot more history, but I'm guessing your heart rate, sympathetic overdrive, is not from your diet, it's from something else going on. Why are you in chronic fight or flight? Do you have stress in your life? Are you not sleeping? Are you, whatever could possibly cause stress could be the problem of your heart rate, and it has nothing to do with your diet. What is this about? We need omega-3s? Yes, you need omega-3s. Lacey, it would be best if you just went from the very beginning and watched this whole show over again. Everybody, if you want to share this, please share it. Please listen to it again. Please hit the thumbs up and the likes and all of that. Uncle Charlie says, forget about keto. You can start off with keto, but eventually will stall and the plants are no good for you, go carnivore. So Uncle Charlie has lost an incredible amount of weight over the years. He is purely carnivore and he's speaking from a purely biased, he's reversed every chronic disease he's had. So he's speaking from the heart, you guys. He's saying, I was once keto. I ate 20 grams of carbs and I felt great. I lost 100 pounds, but then I stalled. And then when I got rid of the rest of the carbs, I magically got better again. It's not magic about not about eating animals. It's what you removed. Uncle Charlie removed processed crapola, and he probably started eating just vegetables and maybe a little bit of fruit, but he found over time that, hey, I'm going to get rid of these carbs. Okay. Keith is under the belief that LDL leads to heart attacks and atherosclerosis. So if we remove, according to Keith, what I hear is that if we remove LDL, we will never have atherosclerosis and we will never have a heart attack. Is that true, you guys? Let's all tell Keith what your thoughts are on that. Vincent says, right, not Morton's, but maybe Himalayan. Maybe not even Himalayan. Maybe that pink color is not really real, Vincent. Maybe it's full of aluminum or iron. Maybe it's full of some other things that you don't want that gave you that color. Maybe you could look into a special website that tells you about what are the best salts right now. Could it be Baja Gold? Could it be Jacobson's kosher salt? Could it be Diamond? All of those salts. But Himalayan, I might stay away from things that might have come from there. Jonas says, one diet is not for everyone. Everyone's body is different. Is it? Is it all that different? I'm not sure. Everybody's body is different. We all have blood. We all have bones. We all have a brain and a heart. What else could be different? The amount of fat you have on your body and the amount of fat I have on my body? Oh, and I Jonna says naturopathic doctors should be free. Should be free. Who's going to pay the naturopathic doctor then? Oh, universal health care. Oh, so we're all going to pay for Jonna and Jimmy, and they're going to continue to drink and eat fructose-filled drinks and fruit, and they're going to go to McDonald's, and we're just going to all pay for universal health so they can have problem or can be solved their problem, and we'll pay for their medicines and their scans and their tests. How is that going to get anybody anywhere? Did that teach you anything about taking care? Did universal health care with some naturopath who's promoting a whole bunch of supplements? Is that going to be the best case scenario? I mean, look at Canada. Do they have anything better than we got? Did Canada teach their people how to eat? Do they not have obesity there and diabetes and coronary artery disease? So they got universal health care. I don't know. I mean, I'm just giving you some things to think about. You want everybody's taxes to pay for everybody who doesn't want to do anything and have any type of ownership for what they're doing. Well, I don't want to pay for them. I'm going to be honest with you. I worked hard for my super stickers and my super chats. I'm working hard to improve my diet, so I don't need a doctor. And you want me to pay for somebody who doesn't care about that? No, let them pay for themselves. Let them buy their food, let them buy their doctor, let them buy their stuff. I don't want to buy their stuff. I don't live in Canada. I don't want to live in Canada. I'm sure it's a delightful place, but I'm not going to move to Canada just because they have universal health care and that would be the the end all be all and I'm not going to have a heart attack. No, those people are hurting over there. They're hurting here. We spend the most money. How much more do you want to spend on your gross domestic product? Look it up. How much does America spend on healthcare? We already spend more than any other nation, yet our healthcare is even worse. And we're going to spend even more money on giving everybody a free, and then everybody should be able to go to a doctor for free. No, what you can do is you can go to AI doctor. They're probably going to be a better doctor. That's free. You don't need any universal health for that. You need to look in the mirror and you, the person looking back at you, is your best doctor. Okay? There's nothing magical about a naturopathic doctor. They might not know root cause of diseases either. They might not know anything about insulin and processed foods. They know about supplements. Oh, you got a little bit of fibrosis in your liver? Oh, this is good. Take this milk thistle. Well, how does that help getting rid of what was causing the problem? Okay. Casey says, thank you for your wisdom, guidance, and encouragement. You're welcome. Yes, I'm very passionate. I hear you. Allison says, we certainly can't live in fear. I agree. There's nothing fear will get you unless, of course, you are running from a lion right now. You got feared and you need to run fast. Run fast. But you don't need to be running. Usually lions will give up or you will give up. They aren't constantly chasing you all day long. Why are we in sympathetic fight or flight all day long? We don't have lions chasing us every day. Um, I'm 70 and my heart rate is most of the time 90 to 100. Should that be considered okay? No, it should not. Karen says, do you do telehealth appointments? Yes, I do. It's just a consult. It is not medical advice. It's for information purposes only. And I'm on thyroid medicine. I was on 90 milligrams of NP thyroid. Now I'm on 50 of levothyroxine. So you went from a T3, T4 combination to just a synthetic, that's what's levothyroxine, synthetic T4. I don't want to be on any of it. Well, how do you know what's wrong with your thyroid is my question. So yes, it would be in your best interest to, well, it might be in your best interest to sign up for a consultation and go over everything. It might be. It might not be. Details said it was well worth it and everybody should do it. I forgot to read that comment, but Details has done a consultation and he got a lot out of it. Okay. He got a lot out of it. Sean says, hello. Hello, Sean. Thank you for being here. Vincent says, you've just characterized my PCP. Hi. Hi. Mm, This is Buddy Blue. Hi. Hi. I just said hi. Jonna says, okay. We're still talking political stuff, so we can probably get rid of all of that. Okay. I'm worried about getting a colonoscopy, says, oh no. Um, what are your concerns? What are you concerned about? What are your concerns about getting a colonoscopy? That that you didn't clean yourself out well enough? That they will go up with a tube through the rectum and up through the large bowel, and they might poke your colon or cause an infection because they didn't clean the tube? Or are you afraid that they might find something that you didn't want to find? What are you worried about? Are you worried about the ride over? Are you worried about the ride home? I don't know what to tell you. You could get one colonoscopy when you're 50, get a baseline. If it's clear, there's no um, polyps, there's no ulcerations, you you could be good for 10 years. Thank you, Clad. I appreciate it. Or CLA for donating to Rescue Rehab Rehome. I appreciate that on Instagram. Yeah, I know, Vincent. We've all made mistakes. Yeah, they might poke you accidentally. That could be a problem. They have done a lot of them in time, and if they poke you in, incidentally, without, you hope that they are able to cauterize it and fix you. I've had a lot of patients who ended up with, bad bacteria, and then we had to treat them with medications. But again, these people start out not so healthy. They eat an inflammatory diet. They might smoke, they might drink, they might get poor sleep. So your colon is just as inflamed as the rest of your body. Now, here's what could be good. If you do have a polyp that could, in a decade, lead to cancer, do you want it gone? Or do you not want to poke a sleeping bear? I don't know the answer. I understand that you're scared or worried. I feel for you. I just can't put myself in your shoes and tell you what to do. I just don't know. Is that a possibility of being poked? Yeah, it is. But out of 1,000, does that happen 1 or 2 times? I'm not sure. I'd have to look it up. So you have to look at, the risk or the reduction, or, what are the odds? Look at what are the odds, okay? Okay. Um, Karen says, I'm on it also at 66. What are you on also? I'm not sure. Oh, and you're on Synthroid. Karen are both on Synthroid T4. Glad I found this page. You're very well. I'm glad you found it too. KC says, if you can get a doc to recommend the scan, is the serum carboxy terminal propeptide of procollagen type 1 with doing? Oh my gosh. KC, you stumped me. I don't know. I'm not sure what you're asking. Stain Keto says, my CT lung scan ground glass went away. Stain Keto? That's awesome. My question is, was it really there in the first place? But I can't answer that question. But oh my gosh, what a blessing. Congratulations, Stain Keto. Don't let it come back, okay? Allison says, not true. I see patients, I'm a nurse, that go back for bypass surgery and their lipid panel is perfect. Yeah, I've seen it too. Thanks, Allison, for sharing your experiences. Sean says, my thoughts are LDI may not itself, oh, LDL, I'm guessing, may not itself inflammation, artery, limen, damage, insulin resistance, so many factors, blood pressure. I'm not convinced it's LDL. ApoB may be important. See, that's where where ApoB. ApoB is a way to kick the can down the road or give you something else to hyper focus on. All LDL particles, all VLDL, all LP little a's, everything has an ApoB. You've been led to believe that the ApoB protein causes plaque. Really? All ApoB causes plaque. Well, what if you have a pattern A, all large buoyant LDL? If ApoB is the cause of your plaque and your heart attack, then we not only need a medicine to get rid of LDL, we need a medicine to get rid of VLDL, IDL, LP little a, so you won't have any lipoproteins carrying any cholesterol to any of your cells. And so your cell membranes will be empty and you will fall like a heap on the floor. Getting rid of ApoB means actually getting rid of every particle that carries cholesterol. Is that the answer? We don't need cholesterol? God happened to make all of our cell membranes full of cholesterol and we don't need it? God made our brain full of cholesterol and we don't need it? No, we've been bamboozled. We've been bamboozled by the buffoonery. Will sleeping late cause heart attacks despite getting a full 7 to 8 hours? It has been theoretically hypothesized, Sean, that you should wake up when the sun comes up and go to bed when the sun goes down and try to get 8 hours of sleep every night. Full sleep, not just laying in bed sleep, but sleep. So if you there's studies that showed that people who go to bed early and get up early live longer, longevity, despite anything else. I guess all variables are the same. You took exactly the same LDL people and the same A1C people, and you just measured their sleep. You put them in a sleep lab for 1 year, and then you tested all the metrics at the end. No, study's not been done. But what they did find is that generally people who go to bed early and rise early have more longevity than a person who goes to bed late and sleeps in late. Just what the data says. Whether it's true or not, I don't know. Okay, Sean is giving his, let's see. Here, my puppy looks like your Gretchen. I bet Gretchen is fantastically beautiful because Buddy is fantastically beautiful. Uh, Pisces says, Dr. J, you're funny today. Thank you for your straight talking brilliance, says Dina. Oh my gosh. Sometimes I just get on a roll and I apologize, you guys. I apologize. Um, I I just am passionate about not being tricked anymore. I'm so sick of being bamboozled by the buffoonery that I I just want to spill the beans about it. I'm tired of being bamboozled. I've spent nearly all of my life being bamboozled, and I'm tired of it. There's got to be something different. And so I spend my time going down rabbit holes trying to figure out if there is something else to explain the something. It's got to be. It cannot be written in stone that it is this way and not something else. Okay? It just can't be. And it goes with anything out there. It could be what our soil is like, what doctors are like, what anything. It's just the whole world. And that's why my heart keeps coming back. If I stick close to Jesus, things, yes, could be hard, but it can't be as hard as we are making it and living in this system of buffoonery. I did it and I don't want to do it anymore. And you guys listening to me, I don't think you want to do it anymore. Okay? Shirley says, Iron Lady dachshunds are the best breed. Well, I could be a little biased and I would agree with you. But I also, I've had German Shepherds. I love German Shepherds. I love all dogs. I really do. And I would rescue, if I could, I would rescue 30 of them. I just can't though. You guys will already call me um crazy dog lady or something. I don't know. Oh, Karen, I'm sorry about you got a fistula. That's awful too. But they can be fixed. Just bypass it. Amir says lean mass hyperresponders, are they safe? A lean mass hyperresponder has high LDL. They are usually a carnivore and who has extremely high LDLs. I still look. I want to know, is Amir a producer of LDLs? Is Amir an absorber of LDLs, hyperabsorber? What is it about Amir that is causing the high LDL? I'm going to get an advanced lipid test on Amir if Amir came to me. I want to know how many large LDLs, medium LDLs, small LDLs, oxidative LDLs. I want to know the full picture. I want to know if Amir has a problem with CTEP, with PCSK9, with LDL receptors on the liver cells. I need it all before I can say, Amir, I think you're safe with your lean mass hyperresponder, because lean mass hyperresponders can have heart attacks, even if their LDL pattern was A. They can still get a blood clot. They could still be stressed and no sleep and over exercising and a workaholic and having trouble with their wife or husband and their kids are druggies or whatever it is, Amir. I could look at it all. I could give you my opinion, but just believing the carnivore people out there and say, hey, I'm a lean mass hyperresponder. They did the data and the data shows, well, actually the data's been taken off the market. The data's gone. It's been scrubbed. The study was taken off the market. Dave Feldman, all of it gone. Gone. Why? Because the company who looked at the scans had fraudulent data. So we don't know anything. Amir, there might not be a thing called lean mass hyperresponders. It seems legit that all my lean people with muscle and work out all the time have high LDLs when they go carnivore, but it needs to be looked into, Amir. I don't give a green pass to anybody until I feel safe. I've looked over and turned over every leaf and every stone that this possibly could be going on. And yes, I will ask you to get tests. And yes, that costs you money. And I apologize. You do not have to get any further testing or anything like that. Okay. I'm just giving you information. Do not think that you are safe just because you're eating a carnivore diet. I don't know what your blood factors are. What if you have high LPL, LP little a? What if you have high fibrinogen? What if you have factor 5, factor 8, prothrombin mutation? A carnivore diet will not protect you from that. Blood clot risks. You're not going to have a problem because of plumbing being plugged by hard plaque. No, you're going to have a problem because of a blood clot that plugged up an artery to your brain or your heart. It has to be looked into. Oh, thank you, Pisces. I appreciate that. Ketogenic diet for 2 years. My LDL was 90 before, and now it's, did you tell me what it was now? Um, yeah, Vincent, it is universal sick care. We're still on universal sick care. Okay. Yeah, Angel, it's possible that big pharma fixes one thing to damage more things in the process. It's possible. It is possible. Okay. Um, we'll we'll end here today. Um, let's pray for Lucy. Lucy she is my moderator on YouTube, my blue shield, my blue wrencher. She helps and she had to run off to help somebody with a website because that's what she does. So let's pray that Lucy got that all fixed up and pray for everyone listening right now that they have clarity and peace and that they, you know, hold fast to that which is good, but they got to test everything according to First Thessalonians 5:21-22. Please go read that verse. Embedded in your head, First Thessalonians 5:21-22. And it says, test everything, examine everything carefully, hold fast to that which is good, and abstain from that which is evil. Hold fast and test everything to what I'm saying. Don't take my word as science. Take it as a hypothesis, a speculation, something for you to look into, maybe something for you to run by your doctor, but know that they might not know the answer either. But don't let them say, that's not true. I think you got that wrong. Well, how do you know? How do you know that they got it right? Bye, Pisces. Thank you. I'll be back tomorrow, you guys. I'll end this right now. First, that's Thessalonians 5. I don't know why I have trouble saying Thessalonians, but 1 Thessalonians 5:21-22. Please read it. Please embed it in your brain. That's how you know everything that you know. Okay? Holy Spirit is in your heart, helping guide you, being your counselor. Okay? We'll be back. Lord willing, I will be back tomorrow at 10 a.m. Central. We'll do this again. Bring your questions. I will bring a topic of something I can talk to you about and get you guys to start asking questions, okay? Start asking questions. Start going, wait a second. Is that right? Now I opened up your brain to get it to start spinning, okay? All right. You guys have a blessed Saturday, and Lord willing, I'll be back tomorrow. See ya.